Good afternoon, everybody. I'd like to wish a warm welcome to the Aveshka family, as well our friends, guests, and other colleagues. Uh, this is a very important topic for us to cover, and given its importance and nature of COVID-19, we have decided to open this discussion beyond just the Aveshka employee base to other friends and family, particularly with the ever-changing nature of this disease and its mutations. And also in light of the fact that many of our children are going to be returning to school, and what that means to them, the faculty, the school administrators, and it's important that they have the appropriate knowledge and insight to deal with this very, very dangerous disease. We are very fortunate to have on staff a panel of experts that will be speaking, led by Dr. Jolly, Dr. Parrish, Dr. Lankow, and Dr. Anderson. Before I ask Dr. Jolly to speak, just a couple of minutes on Aveshka. We are very heavily involved in the COVID-19 response, ranging from supporting mission-critical programs at Department of Health and Human Services, at Centers of Disease Control, as well as numerous commercial and I'll call quasi-federal agencies in providing them the subject matter knowledge as to how to return to work safely, as well as, again, we're going to talk today about children coming back to school. So with that, let me introduce Dr. Jolly, who will, with his panel of experts, communicate to you the challenges and the issues that we are facing with this very, very deadly disease. Till?
Thank you, Grish, and thanks to everybody for joining us. So as Grish said, we're going to have a discussion and we're going to show some slides, and then importantly have a question and answer session really open to anyone on. There's a chat function in Teams if you haven't used Teams before. Very easy to use, and you can certainly send us your questions. We'll get to as many of them as we can, and we really want to focus on schools and our kids. With our panel. I'm going to say a bit and then leave it to my colleagues to really talk with you in depth. As you see there on the screen, we have myself. I'm the Chief Medical Officer of Aveshka. Dr. Michael Anderson, who's a pediatric intensivist, working heavily now in the federal government. Dr. Emily Lankow is a epidemiologist and really leads our data and analytics for health. And Dr. Deidre Parrish, who is infectious diseases specialist in Tennessee, a lot of real world practical experience and lots of analysis of what the states are dealing with. Importantly, all four of us are also parents. And so we are sensitive to the issues that parents of children of all ages have to deal with throughout this pandemic. So we'll bring that perspective to this. Next slide, please. A couple of major points to make, and the things you're going to take away. All of us, I think, share the perspective that the things that we know work still work, and we want to still encourage them. COVID-19 is clearly still with us. No news to anybody. Vaccines and masks work, and we're really all in this together. And not just this small group, but we as a nation and we as a world are in this together. We are interconnected like never before. Through air travel and other means of travel, and really need to work together to defeat what is now, we're now at over a year and a half into this, and what's just going to last longer. Next slide, please. We hear a lot of bad news and every day, and not unlike any other talk we've done, since we developed the slides and finalized them a few days ago, there's been news about vaccines and about variants and about disease. So we'll address that. But this, meaning getting kids back in school, which is very important, can be done safely, and we're learning how to do this. This slide references a study from the ABC Science Collaborative in North Carolina from the end of last school year, looking across 100 districts. There are actually 100 counties in the state of North Carolina, and a bunch of private schools, and looked critically at the countermeasures they put in place in what they called their Plan A, which was getting everybody back in school, how masks worked, how distancing worked, and showed that with proper masking, with proper behaviors, kids could really productively have time in school, which is very important. And so there is data to show that we can do this, but we have to do it right. Without any further, I'm going to turn it now to Dr. Lankow, who's going to talk a bit about the data, and then my other colleagues will join in, and I'll make some closing remarks, and we'll be happy to take some questions. Emily?
Thanks, Till. So the first message, my section is really going to be data heavy, and it is to get us back on the perspective that COVID is still with us, and there are good news, bad news stories out there in the data that inform what we do when it comes to schools. So it's going to be pretty data heavy, but I'm going to walk you through the patterns that we're seeing, because understanding why we're seeing what we're seeing really helps us understand what we need to do to protect our kids. Next slide, please. So COVID is still with us. So this graph shows you the daily new cases in the United States, the timeline along the bottom, and it shows you the roller coaster that we've been on over the past year and a half, from the start in March of 2020 all the way to where we are right now in August of 2021. And I want you to look at the colors on the maps that are inset. Those colors show you kind of where we've been and where we are right now. A darker color tells us there are more cases in those counties. A lighter color says there are fewer. And right now we're somewhere between where we were in August of 2020 and where we were in December of 2020. Our numbers look like they've gotten squished a little bit in projection, but I want you to realize that we're about 2/3 of the way to where we were in December in terms of our total case counts right now in the country. And that's not good. That's not where we wanted to be after seeing those low case counts in June and July. And it's hard for all of us to see these data. Next slide, please. We know why this is happening. We know there are three things that are driving these increases right now. The first of those are variants, and specifically a big increase in Delta variant, which has a much higher infectivity compared to some of the original variants. So the graph on the left shows you the increasing percentage of our genotyped variants that is attributable to Delta or Delta-related variants. We know that low vaccination rates in specific locations in the country is also a driving factor in the increase of Delta spread as it moves across the United States. We have some states that have lower percent vaccination rates than others. We also have counties within even very high vaccination states that are very light colored on this map that have low vaccination rates locally, which are vulnerabilities for even our high vaccination states for entry of new variants and for spread of COVID-19. We also know the third factor is behavior, and we'll talk a lot about this through this webinar of how we act and what we choose to do in terms of non-pharmacological interventions, in terms of distancing, avoiding crowds. Wearing masks plays a huge role in transmission. Next slide, please. We get a lot of questions from clients right now about how long this wave will last, and unfortunately, things are very, very uncertain. One of my jobs, as we say internally, is to read the tea leaves, to look at the patterns that are out there internationally and at the national level, and try to make some informed predictions about what's going to come next for clients so they can plan. And right now, it's very difficult to do that. If we look at the teal line, that shows us what the United Kingdom's experience has been with Delta. Starting in May of 2021, we saw increases in Delta that spread across the United Kingdom and seemed to max out about 9 weeks later. The United Kingdom had a lot going for it. It was right as school was ending. They were moving into the summer when folks could get outside and distance from one another. So their experience may speak to what we see in the United States, but it may not. We may see that because we're moving into the fall when schools and universities are opening, we're moving into holiday season when people get together, we're moving into colder seasons when people go inside, and we're moving into times when we typically would see flu and other viruses that might make people more susceptible to COVID-19 as a co-infection. So it's hard to predict if we're going to see this 8 to 9 week transmission cycle, or if it might be much more extended because of these factors. So we're telling clients to really watch the data closely and be prepared that we don't know what's coming. So we really need to pay attention to our behavior now and how it affects the future. Next slide, please. The next 3 or 4 slides, we're going to talk specifically about kids and how vaccination has affected demographics. So we know that right now we are seeing spikes in cases and hospitalizations in children, and that's been occurring since July. We're seeing headlines like the headlines on the right that children's hospitals in some locations are very, very busy, that we're seeing an increase in the percentage of hospitalized patients that are children, particularly in areas of the country that have been hit really hard by Delta over the past month, like Louisiana and Arkansas. And this is concerning to me as a parent. I have an 8-year-old kid who's supposed to be going back to school in less than a month. I know we're all feeling this anxiety. These headlines are very scary. Knowledge is power. So I'm going to break down for you why we're seeing these headlines, because it tells us what to do to stop it. Next slide, please. This is a good news, bad news story in the data. The reason we're seeing increases in percentages of cases and hospitalizations attributable to younger people is because we have successfully vaccinated our most vulnerable older people, particularly our folks that are 64 up. Who were really hard hit early in this outbreak. So if you look at the graph on the left, that shows you at least 1 dose vaccination rates over time. And you can see our older populations in purple. There are 3 lines that show us the different demographics of our older persons. Those have gone up considerably, and we're talking 80 and 90% vaccination rates in some parts of the country. In contrast, our younger adults and our children are not at those high vaccination rates. Some of that is because they've come online and been, able to access vaccines later in the process. And some of that is because of differences in willingness to take these vaccines. There's some hesitancy in these younger populations. So those populations are not as well protected. And we see that when we look at cases and hospitalizations. So on the right, I'm showing you hospitalizations. We see a similar pattern in cases. Our children in the bottom are approximately 30% vaccinated when you look across all children age groups from 0 to 17. And we're seeing very large rises in cases and hospitalizations that really mirror what we're seeing in our younger adult populations. In contrast, on top, we see hospitalizations in our oldest population, our 75 plus, and they are not rising as quickly. Contrast that with the beginning of the peak in September, and you can see why we're seeing these shifts in proportions. Because the earlier outbreak in September, we had very shallow inclines for our younger populations, and the majority of our hospitalizations were attributable to those older populations who had not yet been vaccinated. So we're seeing these shifts. Next slide, please. We're also seeing changes in the rate of increase because Delta is so infectious. So if you look on the left-hand side, that shows you the similarities, the comparisons of how quickly were we increasing from one time period to the next, looking across September to October. And what you can really see is that that older population, our 75 plus, and to some extent our 65 to 74-year-olds before vaccination, really took off at a much faster rate than our younger population, although the overall increases were not as steep as we're seeing now. In contrast, hospitalization rates in the current period are rising at a much faster rate in all populations, and they're much more similar across populations because we've suppressed the hospitalization uptick in our oldest populations. So again, it's a good news, bad news story. We're not seeing so many older people being put in the hospital. That's a really good thing. We are seeing rapid increases in hospitalization across all demographic groups because COVID-19 is more infectious in this Delta form. Next slide, please. So when we think about kids, and this is a very busy slide, but I'm going to walk you through it because it's a key takeaway for why we're seeing the headlines that we're seeing right now. An increased infectiveness of this variant means we're seeing fast increases in cases and fast increases in hospitalization, and that's happening across all demographic groups, although that's suppressed in our populations that are more well vaccinated. So even if kids remain less susceptible than adults, and we do still think they're less susceptible to infection than adults, kids are a larger portion of the remaining unvaccinated people. And you can see that in the top box in the right-hand side here. I ran a little model just based on numbers that are currently available to get a sense of how much more kids make up our population of susceptible people. So the bar on the left shows you an approximate breakdown. If we have a model population of 100,000 people, about 3/4 of that population would be adults in the United States, and about 1/4 of that would be kiddos. If we assume that a proportion of those people are removed from the population because they've been vaccinated, that's happening at different rates. So 40% of our adults would move over to being susceptible now. 60% of our 12 to 17-year-olds might be susceptible now, and 90% plus of our little kids would still be susceptible now because most of them have not had a chance to be vaccinated. There are some trials happening, but not a lot of vaccination. So if we now have a population of 50,000 people who are still completely susceptible, have not had exposure to a vaccine, kiddos make up a much larger portion of kids that could be, or people who could be infected. So we're seeing that in our case counts. As we see case counts rise, a higher proportion of our cases are attributable to our 12 to 17 and less than 12 years old than we saw in previous waves. The other piece we need to understand is Delta is more transmissible. So cases are taking off really rapidly, and that means that cases in kids are taking off rapidly. We're seeing a lot of kids get sick very quickly, and we're seeing some of those kids be hospitalized, and that's what's flooding our ERs and our children's hospitals right now. We don't see a lot of evidence yet that kids are getting sick or getting sicker. So about 1% to 2% or less of children diagnosed with COVID-19 have been hospitalized throughout this outbreak, and less than 1% by a long shot, 0.01 to 0.03% of those kids diagnosed with COVID-19 die from this infection. So very low rates. Severe disease and death in children remain very rare. But if you have enough cases happening all at once, you're going to see a lot more kids being hospitalized. So the graph on the bottom shows you what that looks like for cases, for example. It's a similar story for hospitalizations. If in December, kids were 8% of our total cases because they tend to be a little less susceptible, we're not showing up as cases as often. If we assume they have the same susceptibility, but they're a bigger portion of what's left in the pool, we're going to see a higher proportion of cases and a higher proportion of hospitalizations attributable to children. And we're going to see more cases more quickly because Delta is more transmissible. So this little model was an exercise I did for myself to feel better when I started seeing these headlines, because I want to understand why we're seeing what we're seeing. Right now, we're seeing more sick kids, which leads to more hospitalizations and more deaths, but we're not seeing evidence that this disease is more severe in children, which is a whole different horse of a different color that we would have to deal with if we saw that in this variant. And right now, we don't seem to be seeing that. What we're seeing is if we stop transmission and lower the number of children being infected, we should see less kids in the hospital, we should see less deaths because they're still rare in children. As a parent, that made me feel better because I know how to protect my child. If I can keep him from being infected, I can keep him safe. And we know how to do that. Next slide, please. So I just want to end here with, sort of hinting at where my colleagues are going to be going in terms of how do we keep our kiddos safe? How do we do school in a way that is sustainable and safe for families? If we look across all of the HHS regions, it's just as a way of consolidating the data and looking at it in a more geographic way. What these graphs show you is hospitalization rate increases across the different regions compared to vaccination rates in the total population. And when we look at that, there's a clear and distinct pattern. The central and southern portion of the United States is tending to have lower vaccination rates overall. And those three graphs that I've highlighted show you what we're seeing in terms of hospitalizations of kids. We see this for cases as well. We're seeing a rapid takeoff in cases in children in areas where adults are not as vaccinated. Adults are bringing this home to their kiddos, they're infecting within families, and we're seeing a big uptick in hospitalizations in these regions with less vaccination compared to places like the Northeast, up on the East Coast or up on the West Coast. Hospitalizations are rising the fastest in places with lower vaccination rates. And this tells us that if we can keep working on getting vaccination rates up in those areas, we can protect kids. So again, I want to repeat the good news, bad news story. Vaccination is protecting our older population, so we're seeing a relative increase in the number of kids, both cases and hospitalizations. We don't want to see kids in hospitals, and we have a powerful tool that we need to continue deploying, particularly in areas where uptake has been slower, to keep kids out of the hospital. And with that, I'm going to pass this off to Dr. Parrish. She's going to go into some more detail on variants and talk a little more about vaccines, and then we'll hear from Dr. Anderson about what we can do to keep our kids safe.
All right, thanks, Dr. Lankow. So I'll talk to you a little bit about variants and vaccines. Next slide. So as long as the virus that causes COVID-19 is circulating anywhere in the world, there will be more variants. And that is just a fact. The viruses mutate. Different mutations can cause the virus to have different properties, and that's what we've been seeing. So this graph just kind of highlights, that for a long time in the pandemic, the Alpha variant dominated, but Delta quickly took over starting in June into July. And as this graph, keeps bearing out, Delta is predominant, greater than 90% in this country. Delta's not the only variant that people are looking at right now. A lot of people have been looking closely at Lambda, which is another variant that's causing a lot of infections, particularly in some South American countries. I will say that Lambda has been detected in the US and in most states. However, it just accounts for a very small portion, about 1% of the variants. Delta is really dominating. So there's a question mark of whether Lambda will actually gain traction. Delta might be the stronger variant, for us. So that remains to be seen. As of now, the newer variants like Lambda are not yet variants of concern by CDC, but there is attention. It is a variant of interest, and there is attention to it. So what this means in terms of the development of variants is that we really need to control transmission. We need to control spread of COVID-19 in order to reduce the chance of new variants forming. And the best way to do that, of course, is through vaccination. Next slide. So as Dr. Lankow mentioned, control of our current surge with Delta will require more effort simply because Delta is more infectious. You can see from this graphic, the very first box talks about the original virus causing COVID-19 that came out of Wuhan, where one infected person infected an average of 2 other people. But if you look in the middle box to the right, Delta variant, one infected person infects an average of 5 to 8 people. So that's significantly high. And that is one of the reasons we're seeing this steep upward curve in infections and hospitalizations that we are seeing right now. For Delta, as with all COVID variants, the unvaccinated people are at highest risk. And I'll show you more data about the proportions. You've probably heard about breakthrough cases, meaning cases that are seen in fully vaccinated individuals. Now, to be clear, breakthrough cases are not unexpected because vaccinations are never 100%. So if you think about having a 90 or 95% vaccine effectiveness rate, then you'll have that 5 or 10% with breakthrough. So what is clear is that Delta variant particularly is showing more breakthrough infections than previous variants, and that is a concern. And what we know is that partial vaccination is not protective, meaning if you have 1 dose of Pfizer or 1 dose of Moderna, it's not as protective against Delta as it would have been against Alpha variant. So you really need to be fully vaccinated. So one of the reasons that recent CDC guidance on masking changed is that they studied an outbreak in a population of highly vaccinated folks and realized that infected vaccinated people can transmit the virus, particularly with this Delta variant. And that was the rationale for universal masking indoors, regardless of vaccination status. So the question about whether Delta variant particularly causes more serious illness is still up in the air. There are several small studies, but those really need to be confirmed. As Dr. Langkow alluded to, just the volume of infections that Delta is causing is causing more hospitalizations and severe infections just through the sheer numbers. Next slide. So again, you'll hear a recurring theme as we go through about vaccination, and vaccination is still saving lives, and vaccination is one of our best tools. So this is a little bit wordy table, but I just wanted to have this up here to remind you of the vaccines that we have available in the U.S., the Pfizer, Moderna, and the J&J. And remember that the Pfizer and Moderna vaccines are very similar. They're both mRNA vaccine, 2-dose. The J&J vaccine is 1 dose. All of these vaccines can be given with other vaccines without regard to timing. And that's important for kids because when kids are going back to school, they may need their Tdap, they may need other vaccines. They can get COVID-19 vaccine along with any other vaccine that they're getting. So, so you've heard, so as you know, Pfizer vaccine currently is the only one indicated for ages 12 and older. And there are further studies with Pfizer and Moderna for looking at younger populations, which I'll talk about a little later. In terms of vaccine effectiveness, as I alluded to, effectiveness against Delta variant seems to be somewhat reduced, particularly, as I said, with partial vaccination. Full vaccination continues to protect against severe illness and death. What I mean by that is that if you are fully vaccinated with one of these COVID-19 vaccines, it is possible that you will get infected with COVID-19, but the vaccination will make the difference between a mild infection or a severe infection requiring hospitalization or death. You've heard about some of the syndromes that have been associated with some of these vaccines. For the mRNA vaccines, rare cases of inflammation around the heart, which is usually mild in some, and primarily in some adolescent boys. And then for the J&J vaccine, association with a rare blood clotting and low platelet syndrome. Obviously, FDA and CDC have pored over all the data regarding these different specific syndromes and still recommend vaccination because of the risk benefit. Next slide. So when we talk about breakthrough infections, and a lot of people have heard about them on the news and have seen reports and are, concerned that, hey, what's the point of getting vaccinated if I'm going to get infected? Well, there's a big difference between infections, severe illness, and death in vaccinated versus unvaccinated populations. So if you look on these bar graphs, you'll see that for vaccinated folks, which are the blue bars, and unvaccinated folks, which are the green bars, you'll see there's a many-fold increase in both in disease, the leftmost, in hospitalization, which is in the middle, and in death, which is on the end. So that's a big difference. So vaccination works. Vaccination prevents severe illness and death, and it prevents infections in contrast to the unvaccinated. in red here, this highlights the number of infections in vaccinated Americans. So at peak incidence, there were 35,000 symptomatic infections among 162 million vaccinated Americans. So that's not a large number when you compare it to the amount of infections in unvaccinated folks. Next slide. So this slide kind of alludes to something similar to what Dr. Lenkow was talking about, where in states where you have higher vaccination rates, you have less hospitalization than in states where you have lower vaccination rates. So on this graph, the kind of pinkish, light pink bars with the red arrow are those states that have lower vaccination rates. And you see that the trend in hospitalization is steep and high, whereas the states, which are a little bit of a faded gray down at the bottom, where you have the green arrow, hospitalization rates are flatter. And this speaks to the community, speaks to the importance of community rates of vaccination. Next slide. So some good news. Vaccination rates are trending up. As you can see from this graph, it looks like, this is the day-by-day vaccinations given in the US, and you see it peaked about April and then started trending down. But as you can see at the very end here on the right, it's ticking up and it's trending up. So more people are getting vaccinated now, which is good. And we hope that this continues to trend in that direction. Next slide. So straight off hot off the presses, you've all heard last week that FDA and CDC have approved additional doses of mRNA vaccines to be given. So, I want to differentiate additional doses or third dose of the mRNA vaccine with booster doses. So you can think about it as, these mRNA vaccines, the Pfizer and Moderna, are a 2-dose series for most people. But for some people who have immunocompromising conditions, it is effectively a 3-dose series. What was found was that, and the rationale for this is that people with certain immunodeficiency conditions, which are listed here, did not have an appropriate or adequate response to 2 doses of the mRNA vaccine, which is why they are getting a 3rd dose. And this started just Friday when the ACIP of CDC approved giving that 3rd dose. Next slide. So that additional dose is contrasted with booster dosing. So again, that distinction is additional doses are basically, the primary series for immunocompromised people, that specific group of people. Booster doses are doses of vaccine given because of waning immunity over time. And we all know booster doses, every 10 years, we're supposed to get our tetanus shot, right? To boost that immunity. So booster doses are not yet indicated in the US. There's still question about the need for it and timing and establishing those. There are plans being made right now to give guidance regarding boosters, and that will probably happen sooner than later, probably within the next few weeks. All right, next slide. So what else is happening with COVID vaccines? So some questions we get, when will they be available in younger children? So both Pfizer and Moderna are currently conducting clinical trials in younger children, children from age 6 months all the way up to 11. Pfizer is kind of the first out of the gate, and they expect to have data on children age 5 to 11 in September, with a potential emergency use authorization for this age group in midwinter. And of course, you know, there are a lot of things can affect that timeline, but that is the information that we have as of now. Also, you already heard that Pfizer has submitted to FDA for full FDA approval of their COVID-19 vaccine, and that is expected in early September. Next slide. With that, I'll turn it over to Dr. Anderson.
Thank you so much. It's always a pleasure to be on this panel and to close. And I'm just going to be really, really brief because my three other colleagues really laid it out. I'm a pediatric ICU physician, a former chief medical officer, hospital president, now working for Aveshka full-time, mostly staffing ASPR on the medical countermeasures, the monoclonal antibodies. And Emily and I were emailing back and forth before this and said, boy, this is just such a marathon. And I am first very appreciative of everyone being on this webinar because we care about kids, we care about our families. Two, if you're in the healthcare business or even have someone close to you that's in the healthcare business, this is a really draining and trying time because this is now a preventable illness. And I could not agree more that the only way to stop talking about variants is to get everybody vaccinated so we can stop the replication of this really dangerous and horrible virus. From my perspective, I'll just add three things. Number one is I am concerned. Emily did a really nice job. I am concerned about the surge in children's hospitals. Children's hospitals are a very small percentage of the overall beds in this country. But boy, they're a precious resource we've got to preserve because they take care of really sick kids and they train the next generation and they do research to save kids' lives. So it's all interconnected. We've got to get more people vaccinated, including our children. We've got to make sure we get to herd immunity so that kids are less vulnerable so we don't see these pediatric surges. There's two other things under the, I like Emily's good news, bad news. There's a couple other really trying things at children's hospitals right now. And I was just on the phone for an hour with a leading children's hospital. There's an early and intense RSV season. That's typically a virus we see in the winter. Now it's rearing its ugly head in the summer. That's keeping children's hospitals very busy. And two, the mental health crisis for kids in this country is really, really sad and real. So children's hospitals are really at the rafters as far as capacity. The good news is that great people like the Assistant Secretary of Health, Dr. Levine, our wonderful ASPR, Dawn, the CDC, Dawn McConnell, the CDC, the White House are all really leaning in to figure out how do we preserve and help this very precious resource, which is a children's hospital. So stay tuned for more. I'm very proud to be a part of that work. The second thing is I think you've heard a couple things about the guidance back and forth about masks. Masks save lives. And I think, you know, the CDC has got a little bit of flack for going back and forth. This is called iterating on the guidance. And I've got kids, they're all old, and I've got young grandkids. But boy, if they're indoors, they really should be masking. And then finally, I do believe hope is on the horizon. The fact that Pfizer is really close to getting what I believe close to getting EUA for kids, probably down to 6, and then we'll go younger to 6 months like the flu. I think that's good news, but we can't let our sort of we can't lose sight of the vision of we've got to get this country immunized so we can get back to some sense of normalcy. I won't show you the slide. I would agree with Till that really we want to talk about kids and families. I posted something last night on social media that just was sort of my downloading what's going on in this country. And I'll just read it to you briefly if you don't mind my closing with something less science and more personal. It's not about freedom. It's not about respecting your rights. It's not about red versus blue. It's not about 45 versus 46. It's about defeating a virus that doesn't care about any of that. It's about 600,000 dead Americans. It's about defending our children. It's about saving lives. Nothing else, truly nothing else. Get the vaccine. It's safe and effective. Wear a mask. It helps stop the spread. And let's take care of our fellow man. It's all we have to preserve this very fragile healthcare system. I would agree with Till how he kicked it off. We are in this together, but unfortunately, there's still many more miles to go in this journey. And I'm just really proud to be a part of the Aveshka family, to be helping our colleagues at ASPR and HHS navigate. So with that, Dr. Jolly, I think I'll turn it back to you.
Thank you. And Chris, if I could ask you to advance the slides a bit. I'm just going to close with a couple of major points. Thank you. Yeah, a few things that everybody can do, and this applies to you and your families, and those in schools and everything, and you know, all very important remarks from all of my colleagues. The first thing to do is to really stay informed. This is, you know, science changes, and Mike pointed out a little flack the CDC's taken for changing guidance. Well, that's because the facts have changed. We've learned a lot. We really, I mean, we all recall sort of at the very beginning of this, the first few patients we saw, and we were concerned, and we didn't know what to do, and we just knew to do the basics of infection control. But now we've learned so much more about this virus and what works and what doesn't. So stay informed and use reputable sources. And there really are good reputable sources out there. You know, and don't just take one person's word for things, and don't listen to a lot of the chatter. And certainly those of you both inside and outside of Aveshka who want to vet things with us, we're happy to correct things and help you with information as time goes on. So that's very important. And then go to your trusted sources of information. It's not a surprise that people trust their pediatricians, and related to your kids, pediatricians feel very strongly about this. They are passionate about taking care of your kids and kids all around the community. So really listen to your pediatricians, and get guidance from them about how to best manage your kids, whether they're kids without health conditions or there are lots of kids with health conditions that you need to ask about. So ask about those. Next slide. Your family's physical health is important, and one of the among the many tragedies of COVID has been, you know, a lack of focus on other health issues and just general health. So simple things, you know, eating well, exercising, getting outside, but then doing health screenings. And we had a big drop off in kids' vaccinations over the last year and a half. But getting routine health care is very important. We don't want to create and miss other health things because of our focus on COVID. And pediatricians have gotten very good at managing this. So that's very important. Overall health of your entire family is very important. Don't ignore other things because of this. And next slide, and then we'll close. Dr. Anderson mentioned mental health, and this is true for adults. This is true for kids. We've all seen presentations. We've all seen manifestations of this. And it is a true crisis, and it's a crisis within a crisis. Don't be afraid to ask for help for yourself. Don't be afraid to ask for help for your kids, and really look out for each other. We have been disconnected physically as a population over the last year and a half, and we've all been talking to each other across various video means and telephones and all kinds of things. But really look out for each other and look for signs of people that just need somebody to talk to and need to work out issues. And pay attention to your kids, and your pediatricians will help you pay attention to your kids. And so that's all very important. And this problem is not going to go away anytime soon. Next slide. And then a quote here about resilience, and you can read it as well as I can, but maybe I'll read it very quickly. Resilience does not come from rare or special qualities, but from the everyday magic of the ordinary, normative human resources in children and their families and relationships and in their communities. So we need to sort of use our human connections, and that is true in homes, and it's going to be increasingly true in schools as schools open up. And schools begin to host our kids in an important environment, and help teach them to be resilient. So, Chris, I'm going to turn it back to you. Perhaps ask my colleagues to turn their cameras back on, and we'll take questions as they come.
Okay, great. Thank you so much. Okay, well, we'll start with some of the questions that we received in the chat. So continue to add your questions to the Q&A as we go along. Here we have, can the vaccine be tweaked or modified to evolve with the evolving variants?
Dr. Parrish, I may turn that to you.
Yes, absolutely, it can. And that is something that the vaccine makers are actively looking at and trying to be nimble with what they do, even in terms of thinking about future boosters.
All right, next question.
It was heard on the news this morning that the booster doses are now being recommended for all, not just immunocompromised people, and that it will likely be in October that boosters are available. Is that correct?
Dr. Parrish, you can take that, or you can defer that to me if you like.
Yeah, you can. I'll speak just a little to it, and you can add. So as of right now, as we speak, boosters are not recommended. They are being discussed, and I've seen some reports in the news suggesting that that their recommendation is imminent. That remains to be seen. So, Till, if you have any other info.
Yeah, I don't have any particular inside info, but the news stories certainly are being fairly specific about this and talking about 8 months out from the original dose as a time for boosters, which would be next month for those healthcare workers who got their second shot in January. But we don't have the specific recommendation yet. We hear it's coming, but stay tuned. As usual, the news changes pretty quickly. Carissa, next question.
Is herd immunity even possible anymore, given the number of breakthrough infections? It's our understanding now that COVID is now endemic.
Dr. Lankow, would you like to take a crack at that?
Sure thing. There have been a number of news stories that have talked about a really important number are not. And the current virus, the Delta variant, has a much higher R naught. That's how many people on average an infected person will infect. And Dr. Parrish showed a figure that demonstrated just how important this is. The original variant, one infected person might infect 2 to 3 people. The current variant, the Delta variant, it's somewhere between 6 and 9. There are folks who have done models that suggest that even if we get our vaccination rates up to 70, 80, 90%, that alone may not be enough to get transmission under control. This is now a situation where we need not only high vaccination rates, but we also need to do all the non-pharmacological interventions like masking in public places, staying away from crowds, and using all the tools that we have available, not just vaccination, but everything we have available to get this virus under control. Realistically, I've seen a lot of the thought leaders say that we may not reach herd immunity, that in fact now we're going to be working on controlling hotspots by using all the tools available to us to get to the place where we get folks safe. So not only do we need people to get out there and get vaccinated, we need folks to wear their masks in public regardless of their vaccination status, and we need folks to try to stay separated as much as possible from folks that are outside their household in areas with very high transmission. Schools are our one exception. I do want to plug that schools are so critical for our children. They should be the very last thing we consider closing down, and only if there is an outbreak in a school setting where they need to take some time and get that under control. We may see that, but schools need to be top priority because of how important they are for the mental and physical health of our kiddos.
Thank you. Carissa, next question.
Okay. Some people have had some tough responses to the second shot in particular. Do we know if there will be anything that we should expect in getting a booster?
Yeah, the short answer is we don't know. There was an incidence of side effects, usually lasting about 24 hours. Anecdotally, we heard a little bit more about it happening after the second shot than the first. The majority of people actually had the shots with really no side effects. It's hard to say how this is going to affect people. I think people can expect potentially some side effects, but we just don't know what a third one. We don't have enough experience with people getting the third shots yet. But realize there are people that are concerned about getting the shot because of side effects. It's the side effects, people weather them just fine, and really need to really go about getting vaccinated. And this is true of the initial vaccination too, which remains very important.
Hey, Till, it's Mike. Can I just add one to that? It's anecdotal. It's an N of 1. It's a hypothetical 57-year-old pediatrician. But my second dose knocked me down for 6 hours, fever, chills. It was the most beautiful fever and chills I've ever had. It's not a side effect. It's your T cells and your B cells ramping up to say, I can take this virus on now. So I never celebrated having shaking chills more than I did. And you know, I'm not trying to minimize people, rare people have serious effects. Some fever and chills and feeling run down for 12 hours. That's not a side effect. That's beautiful.
Outstanding. Carissa, next question.
Concerning keeping healthy, wanting to go to the gym and other buildings where people exercise, is it safe for the vaccinated to do that right now without a mask, or should we be masked?
You know, I'll take a shot at that, and then any colleagues who want to weigh in. This really becomes, you know, every question now is related to risk tolerance and what the local environment is. You know, obviously it'd be better if everybody in the gym were vaccinated versus unvaccinated, and there are gyms that are probably requiring that as private businesses. You know, a crowded space is certainly problematic. A gym is a place where people do breathe more heavily and potentially emit virus. If you can wear a mask in that kind of setting, you're much better off wearing it. There are masks that are somewhat more comfortable that are designed for exercise. So this is an indoor environment, and the general guidance is in an indoor environment, wear a mask. Others that may have other opinions, welcome.
Okay.
Krista, why don't we take the next question?
What measures should schools take to make in-person learning as safe as possible?
There are a number of them. Perhaps Dr. Parrish, do you want to take a shot at this?
Absolutely. So some of the same mitigation strategies that we talked about last year still work. Masking is one of the most important. And if everybody in the school is masked, you know, there's been data from the end of last school year out of North Carolina where they actually looked at different schools and how they fared, you know, with these mitigation strategies in place. And infections in schools can be controlled if the students are masked. In addition to that, you know, ventilation, that's not something that, you know, that we as parents can really affect, but things that the schools and the school systems are thinking about and probably working on increasing ventilation. And for those kids that are eligible for vaccination, having those kids vaccinated as well as the staff vaccinated helps. So all of this is that layered prevention. None of these tools is perfect on its own, but if we layer it, we can make schools as safe as possible.
Thank you. Carissa, next question.
Okay. I'm going to merge the next two questions together with regards to social distancing. What measures around social distancing in a classroom do we need to make with large class numbers and small physical spaces? How is this going to be possible?
Well, you know, to tag on to Dr. Parrish's last answer, masking is going to make this a lot better. So the study from North Carolina, and you could sort of look at the details of it if you want, really looked at masking as the most important variable, much more important than distancing. Now, to the extent that schools can spread kids out a little more, I understand that many schools are crowded or overcrowded at times. And that's a problem that has probably manifested itself in flu outbreaks in prior years, and certainly could now. But masking is the most important thing. Distancing is important when possible, and adjusting class schedules and adjusting interaction to the extent possible will be helpful. Dr. Anderson, any other thoughts on that?
No, I think you're exactly right. One of the other interesting things with that, I think we have to highlight some school districts that are just knocking out of the park. And they've got really engaged parents that want to help them iterate the guidelines. The other thing is, you've said several times, Till, and I really appreciate that relying on your pediatrician is really important, because pediatricians have become very quick experts on COVID. I also think it's terrific when school districts have pediatricians just helping them trying to iterate their guidelines, especially, and I think Emily said it so well, we've got to get kids back in the classroom because there's so many advantages to it. We just got to make sure it's safe.
Thank you. Carissa, next question.
Can the disease live outside of the body, like on clothes, surfaces, etc.?
Dr. Parrish?
Yeah, not for long. I think that, as we all know, kind of in the beginning, we were very worried about contact, physical contact in terms of transmission. But what we found is that spread of this virus is primarily through the air, basically airborne and droplet. Regular cleaning with regular, cleaning supplies is sufficient.
Thank you. And we're approaching 6 o'clock, but we're happy to stay on and take more questions. I know people do have questions. So Carissa, we'll take the next question.
Okay. For teachers, how best to stay healthy in a classroom with children who may not be vaccinated? Will things like air filtration machines assist?
Well, air filtration helps, but once again, we're going to sound like a broken record. But masking really is key. And younger kids, certainly the vast majority aren't going to be vaccinated until those vaccines are approved for those kids. And so masking is important, and really paying attention to guidelines about illness, and keeping kids out of school when they're sick, and really educating the parent group about disease control and monitoring their kids for illness. So, teachers can be safe, but they need to make sure they're protected, and vaccination of the teachers is also critical to this.
Okay. It seems like all the data about transmission in schools is based on wild type or alpha, not delta. Aren't we going to see a lot more transmission in elementary schools now with delta, especially given the reduction in distancing and our cloth masks really productive when kids are indoors in a classroom together for hours at a time with delta?
This is a bit speculative. Maybe I'll ask Dr. Lankow to speculate a bit, realizing that a lot of this we don't know.
Sure. So there are a lot of variables that go into risk, right? How long you're together, how close you are together. Are you wearing a mask that slows down that exposure to particles in the air? And are you vaccinated, right? We talk about the Swiss cheese model over and over and over in these town halls and in every client meeting. And so there's lots of things schools can do to try to reduce the potential for exposure. They can follow all the guidelines. They can cohort so classes don't add mix in areas like gyms and lunch. So you have groups of students that are always together. So if a student is infected and exposed, that you're not exposing every classroom in the school, right? All of these tools were in place last fall and will be in place, or last spring, and will be in place this fall. I think the person asking the question has a valid concern that this is a more infectious virus. So it is possible that we will see more outbreaks in school settings, but often the source will be from kids getting it from their parents and bringing it into the school setting. So again, we have a responsibility as parents to get vaccinated, to reduce our exposures, to reduce the risk to our kids so we don't send them in with the virus. And the schools have the responsibility to enact all of these in-school setting responsibilities like ventilation, making sure the kids adhere to mask wearing, keeping physical distance, cohorting, and testing. And if we work together, hopefully we can reduce the potential for infection in the school setting. But I think the person asking the question is very right that we may see local settings with very high infection rates where we do need to shut down schools or specific classrooms for short periods of time to get infection under control. And that may be more common this fall than it was back in the spring. These tools work. We've seen them work. They may work a little differently with a more infectious virus. And so we may have to adjust as we go. And this gets back to what Dr. Jolly said about CDC, also Dr. Anderson, that the guidance may shift very quickly as we learn more. And as that shift happens, we as parents need to stay informed. We need to support our schools in implementing new strategies and keep up with what's happening because things are very dynamic right now. Our best approach is to follow the guidelines that are currently available based on the best available evidence and be prepared to move with the guidance as we learn more.
Thank you.
Thank you.
Chris, the next question.
If you have kids who are unvaccinated, ages 2 and 5, and relatives who refuse to be vaccinated, would you keep your kids away from them?
It's a tough one. But when you are out in the world, it is likely that you're around unvaccinated people, and we're protecting our kids, particularly our unvaccinated kids, as much as possible from them by avoiding contact as much as possible. If you've got an unvaccinated relative who refuses to be vaccinated. I don't want to get in the middle of family dynamics, but this is a difficult choice these people have made to put others at risk. Now, could you as a vaccinated person also carry the virus? Yes, we know you could, but you're at much lower risk and you're infectious for a much lower period of time. So, I can't tell families what to do, but those people are putting your kids at risk.
Does it basically come down to being that everyone is going to catch the virus in some manner? Is it just a matter of time or a matter of whether you choose to get it via the vaccine or through catching the virus itself?
I'm going to turn back to Dr. Parrish.
Yeah, so thanks. So there is more transmission now, and as you've seen in a lot of our data, much of this current surge, this current wave is happening and is being pretty much carried by the unvaccinated. So yes, there are breakthrough infections with vaccinated folks, but it's really the unvaccinated that are getting infected and where this virus is spreading. So to be clear, it is always better to get immunity from vaccination than from infection. For many reasons, primarily of which, this virus can cause severe illness and death, as we've seen. So, and I will also say that immunity from infection with the virus is not as durable, not as long lasting as immunity from vaccination. And what we're seeing now is that those people who have been previously infected, maybe they got infected last winter, they're getting reinfected. So vaccination is still, like we've been saying, one of our best tools, and particularly for reducing the spread of this virus so that more variants don't develop, and really also protecting our children who are not yet eligible for vaccination.
Important points, and I'll just add in, there's a reason that you're hearing the same thing from all of us, slightly different words, because vaccination works, masking works, it's protective, and we're very consistent on this, and our colleagues in science and medicine are very consistent on this. Next question.
So we've talked about how the virus is not as easily transmitted on other surfaces like outside the body, but is the extra cleaning efforts, like cleaning the school desks, knobs, doorknobs, things like that, is that still recommended?
I'll weigh in on that a bit. Remember, for COVID, it's certainly not a bad idea to clean surfaces, and realize that we are, as Dr. Anderson pointed out, we're already coming into we have an early RSV season, respiratory syncytial virus. We usually see that in the winter, and now we're seeing it in summer. And flu and other things are going to come at us. And we really want to combine this with COVID as little as possible, because, multiple respiratory viruses in hospitals and in other settings is just a bad thing. And cleaning surfaces can certainly help with those. So hand washing is still the most important thing from a cleaning standpoint. And cleaning services is a good thing. As we know, you get kids together in settings in the winter, and they're having various secretions from various respiratory viruses. The more we can do to keep them clean, the better.
Okay. We've heard from the administration that vaccinated people don't have to social distance. Should organizations still practice or require social distancing for in-person meetings and conferences if they do not know the vaccination status of the participants?
Dr. Anderson, your thoughts on this?
Phil, he may have left.
He may have. That's okay. I can certainly address that. I think, we're now seeing a coalescence of guidance for the vaccinated and the unvaccinated. It's been a bit of a messaging problem to say that The vaccinated could go without masks and the unvaccinated need to be masked. It's very hard to tell who is and who isn't. Now, because of disease dynamics, vaccinated, unvaccinated need to all be masked. And, 99% of the population lives in an area of high or substantial transmission now. So, until we get this under control, which we do not have this under control, my recommendation, and I think most recommendations would be, we still need to practice social distancing, particularly in meeting settings and in rooms, remain masked and try to remain as safe as possible. We do not have this under control yet. Next question.
How much have the vaccines changed since they first came out?
Dr. Parrish, if you're still there.
Yeah, I'm still here. The vaccines haven't changed themselves. But I'm not sure exactly what that question is getting at.
I think probably like in terms of the formula or what's being used or in the vaccine as the variants evolve.
No, the vaccines are the same as they have been. And as we kind of alluded to in an earlier question about, adapting the vaccine related to variants, the vaccine makers are able to do that. And that may be a consideration if and when boosters are recommended. But the current vaccines are the same vaccines as that they were authorized under their EUA.
Thank you. Okay, and should testing at schools continue for vaccinated individuals?
A bit of this, and Dr. Lankow may have an opinion on this from an epidemiologic standpoint. A bit of this depends. It's a good question. It depends somewhat on local dynamics. In an area of high disease transmission, routine testing of vaccinated and particularly unvaccinated populations is more efficacious, more likely to catch positives, and more likely to aid in disease control than in lower transmission areas. And it kind of depends on how closely kids are congregated in the schools, and then following any outbreaks in the schools. So really, there's an it depends answer, but we do know that vaccinated persons can carry disease, and testing them can be part of an overall program. Dr. Parrish, I see you there. You may have a thought, and then Dr. Lankow.
Yeah, I'd echo what you said. I think the purpose of testing in schools is to get a handle on cases in order to quickly exclude them, quickly identify contacts and exclude them from school to prevent school outbreaks and clusters from happening. So there are different approaches and methods to doing that using testing, using screening testing. So Dr. Lankow, do you have other comments?
I was just pulling up CDC guidance, and currently they are recommending screening testing for up to 10% of the unvaccinated populations at schools as a sort of way of looking for cases. I think they still do recommend any symptomatic student or teacher should be tested, because vaccinated and unvaccinated persons can be infected with this. So I suspect that guidance will update as we see what happens at schools. Right now, they're focusing on unvaccinated populations. But they may change that guidance in terms of what the screening tools are doing for looking for infection within the school environment as we understand more about how schools are operating. So again, I'm going to reiterate our messages: stay informed, be ready to shift with the guidance, and really keep up to date on what's happening, because it may move pretty quickly this fall.
Thank you. Krista, do we have any other questions?
A couple have been added here. So for those who are pregnant, is it safe for them to get vaccinated?
The short answer is yes. This is strongly recommended by the American College of Obstetricians and Gynecologists. Pregnancy at any stage, it's important to protect the mom from COVID, because pregnancy and COVID is a very bad combination. So yes, this is strongly recommended that pregnant women obviously speak with their obstetrician about that if they have any questions or concerns. This group of specialists is certainly on top of this issue with pregnant women.
And that's a great question, and I'm glad the questioner brought that up, because one thing that I didn't mention in my talk was, there have been a lot of concerns, based on misinformation regarding vaccines and fertility, as well as vaccines and pregnancy. And in fact, the emergency use authorizations of the vaccines have been amended to state specifically that they are recommended for anybody who is pregnant, who may become pregnant, who is planning to become pregnant at any stage. So, so there's no issues with safety in pregnancy and no effects on fertility.
Thank you. Carissa?
Are the vaccines safe for kids with egg allergies or other allergies that might be in the shots?
Yeah, there's no component of egg. We know about potential egg in flu vaccine and reactions there. There's no egg component of these vaccines, and there really is a very small risk of allergic reactions of any known components. Dr. Parrish, any other thoughts on that?
You said it all.
Okay.
Thank you.
And for someone that had, for example, the J&J vaccine, could they get a dose of one of the other vaccines?
Dr. Parrish?
So short answer is not at this time. Again, that third dose recommendation that I talked about that was just approved last week for a specific group of immunocompromised people who had received one of the mRNA vaccines, Pfizer or Moderna. And that's for a third dose of the same vaccine, but if necessary, those could be interchanged. Now, remember, J&J is a different type of vaccine. And there hasn't been enough studies to date to indicate a need for an additional dose of J&J. That said, some other countries have looked at mixing and matching doses. That's not something that has been really recommended in the US. So there'll be more to come on that in terms of future data.
Thank you.
Okay.
Carissa,
And
anything else?
last question here. Do we think that a 3-foot distancing, would that be adequate with the Delta virus?
Yeah, this is a good question and related to other questions we've gotten over time. So, one caveat in this is 3-foot distancing with masking, which still works with the Delta variant. The particles leave the mouth and nose at the same velocity, regardless of the variant. So, we think with masking, 3-foot distancing, as the data would show, that it was currently thought to be adequate. I suppose things could change, but with masking and with adherence to the other guidelines, that distancing was good. And to the point that Dr. Parrish and I talked about, the North Carolina study showed that masking is much more important than distancing when masking is properly applied.
And Dr. Jolly, I would add ventilation has come out as one of the most important variables that schools can control to some extent. So opening windows, making sure there's lots of good airflow. Ventilation does a great job of moving the air away from folks as they breathe, so those particles don't linger in the atmosphere and get breathed in by someone else. So, we can't control how infectious this virus is, but we can use all the tools, and the science shows really good ventilation with masking, with appropriate physical distancing, can all really help with reducing transmission risk.
Thank you. Krista,
that's all we had for questions.
Okay.
That's it.
Great, thanks. And I want to thank you for joining us, and I'll turn it back to Girish for some closing remarks in just a second. But I want to thank first my colleagues, Drs. Lankow, Parrish, and Anderson for really sharing their expertise as we do on a regular basis. And I want to thank both our colleagues from Aveshka and our friends and colleagues from outside of Aveshka for joining us. These are obviously important issues, and they are ever changing. We've done a number of these town halls, both internally and externally, and we keep coming up with new information and new data and new things to really talk about that people care about. This particular issue of children in schools is very timely, and we certainly will carry on with these forums in one way or another, and continue to share information as we have it. So continue to stay safe, continue to learn about this with us, and we'll keep sharing information with you. Girish, I'll turn it back to you for closing remarks.
Thanks very much, Till. So first of all, let me, add my thanks again to all of you for sharing this information that is so vital and critical to all of us. We're dealing with, as I said at the outset, our most precious assets being our kids and grandkids. We all have a lot of apprehension as school year begins and as we carry on with our lives. But I think the information that that all of you have parted with is truly invaluable. As you also mentioned, we will continue to do these town halls and look at including, family members and friends outside of the Aveshka family. Secondly, I want to thank all of you who have joined us and, listened very intently over the last 75, 80 minutes. We will, as Till said, continue to do these town halls and provide the information so we can all stay safe and healthy in dealing with this very persistent virus. So in closing, stay safe, stay healthy, and I'm sure we'll look forward to seeing you all again in future seminars like this. Good night and stay healthy.